our senior CEO, one of the most amazing, great people we have in this country. Thank you so much, and welcome, sir.
The big question that we shall be addressing by the end of this session is, did you find something to take home since women health? Did you get something to share with your neighbor, sister, auntie, grandmother, and the rest since women's health matter? I'm privileged today to also be one of those who will be moderating our session. Why indeed women's health matter. And luckily within that session, we shall also be having a very kind gentleman who has accepted to be in that particular session. So I will not take so much time as at now, but I will welcome back the MC so that he can invite our key speaker. After the key speaker talks, then, or rather gives us the insights of what brings us equally all together, we shall now plunge into the first moderated session, which I can promise you will be very, very, very interactive, very enjoyable, and yourself also be open-minded, open up your heart, so that ask the questions as well to my panelists who will be on stage. And with those few remarks, asanteni sana for at least engaging with you.
Good morning, good morning, good morning. I'm happy to be here. Thank you, Humphrey, for the invite, and your whole team. It's been really lovely engaging with you all. I hope our French speaker will hear a lot of the English that we have today. So mine is just a general topic about advocacy for women's health in this country. And I want to start by asking, how many women die in childbirth for every 100,000 children born? Does anyone know? The number of women we lose for every 100,000 children born. Anyone? Any rough idea? Just give me a ballpark figure. Is it a single digit? Is it double digits? Is it in the hundreds? Is it in the thousands? Are we doing better? Are we doing worse? Anyone? Can you believe? Yes? 500 women die. We lose 500 women for each and every 100,000 children born. Are their lives worth losing? Not at all. We don't need to lose any woman. They're contributing to the pool of beautiful people here, as our MC says. Why should we lose 500 women? In countries like Sweden, when one woman dies, the flag starts flying half-mast. Half-mast. One. Us, Nyatano, oh my God. Business as usual. I think we should really get on board. So when I last speak about advocacy for women's health in Kenya, I said, let me ask my audience, do they know how many of us women are dying as we give Kenya children? It's very, very, very high. And these causes are preventable. Very, very preventable. Inadequate healthcare, infrastructure, limited access to birth agendas. Am I speaking gibberish? What I'm trying to say is, when you're pregnant, go and see a healthcare provider. When you want to give birth, go and do it in a facility. Don't try and do what our grandmothers did at home, because that's how many of us lost our mothers and our grandmothers and our young girls. We are talking to young girls to stay in school at least 12 years minimum. 12 years of part education. Or part education. So our leaders have to be in the steering wheel to assist us in this fight, to assist us not to lose any women in childbirth. We want to discuss with young people about sexual and reproductive health and rights, about contraception, about HIV. We want to talk to them about their periods. We want to talk about pap smears, just examining your breasts. household. Hello, can I look at your breasts? No. You have to know what your normal breasts look like. So if there's a problem, then I know, oh my God, I have to go and see a doctor. You cannot tell the doctor, oh, this breast has been here, and this one here. This one produces blood, but it's okay. I not that. No. Your health starts with you. Of note is that very many of us women have reduced the number of babies. We used to have 12. How many sisters may have reduced to how many? From about 8 to 6. Now how many babies per family or per woman? 2. They're saying it's reduced to about 3.4. So there's a shift. Women are using contraceptive methods. We are going to facilities to have our babies. We're using modern methods. I work at the University of Nairobi and I interview the young girls who come to me. Which method are you using? The common one. I'm like, oh my God, I didn't read that one in school. Which is that common one? And I thought, poop. They do and it's failing. Let's talk to our young people. I'm talking about there's no condom. Tell them there's no condom, there's no party. Never kuna party. Utakuna na condom, sapana, no party. Because pull out will land you into problems. And many of our young girls are dying because of unsafe abortion. Please let's talk to our young girls. No more pull-out method. Condom will assist prevention of HIV, prevention of pregnancy, prevention of STIs, and we are able to maintain these girls. They came into university HIV negative without a baby. They leave with an education, not with 2 degrees, doctoral and degree actual. Some don't even finish because they got caught up in the middle of something.
Advocacy plays a vital role in addressing these challenges as we raise awareness, including the importance of comprehensive maternal health services and child health services, and policy change. We spend a lot of time writing policies. We do not make sure the policies are reaching where they're supposed to reach. Our policies are beautiful, on the shelves, collecting dust. Let's talk to our leaders so that these policies find their way into the ground. I want to empower communities, engage civil societies and grassroots movements, advocate a collective voice in decision making, and hold our leaders to our account. Hold our leaders to account. Is there a bright future? Is the future bright? That's the question for today. Unless we take steps to highlight the need for multi-stakeholder collaboration, the government, private sector, NGOs, and the local communities working together, there will be no bright future for us, I'm sorry to say. We need to involve everybody in decision making. Men, women, young people. Empower women making informed decisions of their health. Support their economic empowerment. Until recently in Kenya, a woman could not hold land, could not open a bank account. Has that changed? Yes. There's a brighter future. Things have changed. You don't need to be married to have a bank account. You don't need to be married to own land. You can take things into your own hands. Only if you've been through the system and you have some sort of education. So that will empower you. We want to urge both the Kenyan government and international community to allocate more funds to women's health, promote fundraising campaigns. I know right now people are crying, Trump. Is he your president? He's not. Why are you crying for Trump? Did you vote for him or not? We voted for our leaders. Let's work with our leaders and also go a step forward as we target women's issues. In conclusion, as I advocate for women's health in Kenya, it's not just a necessity, it's a moral imperative. We have to address barriers to access and promote equitable healthcare policies as we improve our health and the well-being of women and children across the country. We're not leaving any man behind. We're pulling them with us. As we move forward, it's essential to harness the collective power of advocacy to ensure that women's health remains a priority on the national agenda to the broader goal of gender equity and sustainable goals. I end with a quote from one of our past presidents of the Fédération Internationale de l'Éthique and Gynécologie, FIGO. who said that women's lives are worth saving only if our leaders make it a priority. Are our women's lives worth saving? If our leaders make it a priority. I thank you very much for your attention.
A woman empowered is a community empowered and a nation empowered, right? And we recognize that women are in different stages. The health needs of a young girl is not the same as the health needs of a woman. Right? The health needs of a woman are different as she evolves and navigates into menopause. Right? So as MSI Kenya, we have a package for all these three stages of women. We have one for the teenager, the aspiring young girl. Hi, what's up? Psych level. Alright, so this is for the tip-top teenagers, because we understand adolescence is a very, it's a time of transformation, bodily changes, alright? This is the time that we go through, the monthly changes, and sometimes our young girls have a lot of questions and uncertainties for what the transformation that they're going through. And the package that we have for these young girls is we have a menstrual package where we are able to take you through, the different stages that you're going through. And those who have, what we call dysmenorrhea, painful menses, we do have a package for you. We are able to take through, investigations to ascertain what is not happening to you. But it's not normal, you get me? Let me give you a story. One of counties that we support, Les Amis, there's a young girl who came to us. She had accompanied her sister, and she was around 17 years thereabout. And we asked her, why are you not in school? I mean, it's on a Friday, why are you not in school? And for her, the taboos and cultural beliefs around, she was accustomed to the heavy menses, painful cramps that she was having. And she thought it was normal, right? So we took her and did some POCAs, that is going to be an ultrasound. We were able to find what was going on with her. She had what we call endometriosis, right? And we were able to take care of her, give her medication. And right now she's okay, she's fine. So we have that package for the teenagers who are going through these life changes, right? Secondly, we also do offer STI screening and HIV testing. We cannot be here and not talk about the triple threat that is affecting our country, HIV being one of them. So we do offer a couple of testing, right? And we also have HPV vaccination, that is human papillomavirus vaccination for cervical cancer, which is the second leading cause of mortality in women. And at this early stage, we are able to vaccine, give you vaccination, and prevention is better than cure. We'll be able to reduce the burden of cervical cancer in the country, right? By making sure that healthcare accessibility is paramount, so that our women can be able to access healthcare without difficulty. Okay? All right. Women are extraordinary. They bring life to the world, right? They build nations and build nations. Okay? And so, for the partners in the house today, let us commit ourselves to make sure that healthcare is accessible to our women.
What did we develop in the women's health in the recent years? Carol, I didn't believe in one of these programs, by the way. Then reading around it and looking at the opportunity, not only the opportunity, awareness to the women. We started a pathway, what is called a wellness program. And I'll take you through it. I think you have pamphlets now, which will tell you. I was thinking there was going to be a screen, but it doesn't matter. We've just given you a package deals that we make. Why don't women think of themselves? I think a woman is the custodian of family health. Really, she is. Ask Carol, who brings Mama Shosho's children to see her? It is a woman, not a man. Have you ever seen a man taking his mother to a doctor? No. daughter or a daughter-in-law. So I believe a woman is the custodian of that family. And I'll tell women, I talked to some young people the other day, and I asked them, do you know about family health? Do you talk about genetic diseases in your family? And majority, I was shocked. 80% of those youngsters said, we didn't talk about health in the family. I said, have you asked your mother? Have you asked your father? Was there inherited disease? Did people have breast cancers in your family? Did they have heart disease in your family? Do you know, majority of the youngsters disease didn't know. First of all, I want to tell you, a lot of diseases we are finding out are genetic, are related. The family chances increase, and I'll mention that as and breast is one of them. So get a family tree, get a history. You know, that aunt died very young. What was the cause? Family, she looks after the health of her children, and very rarely she looks after her son, because she's so busy looking after others. So what does this involve, the wellness program? And from the beginning, if you just look down the list, we do simple things like we check your hemoglobin. I have so many women, I was told to tell you, in my long experience in pathology here. So a woman will say, oh, I'm feeling tired, I worked very hard. You know, I cannot really take care. What is wrong with me? Oh, must be overwork. Oh, I had a fight with my husband. Oh, I had a fight with my in-law. No. If you are tired, please take care of yourself. One of the reasons you can be feeling so tired all the time is your hemoglobin is low. You'll be shocked. When we do this wellness program, we realize how many women are walking around with a very low hemoglobin, and they're just accepting it. Come on, ladies. We can't afford to have you weak because you are looking after your family and that very extended family. So we do the hemogram. Now, when can you get anemia, even your daughter? So the commonest cause of, Karen, correct me if I'm wrong in your field, the commonest cause of anemia we find in the women is that they have heavy periods in the menstrual time. If they have heavy periods, they will get anemic if they will not seek medical attention, even your daughters. Remember, if your daughters have heavy periods, they're anemic because of that. So please take them for a check, take them, make sure that they're not weak because of the too much blood clot. The second cause of anemia here is, of course, our women are having many babies. In 10 years, we had 8 babies we were breastfed. That is a persistent pregnancy, and if you do not have the diet nutrition, you will be anemic. So anemia means reduced hemoglobin. Remember, your husbands also get anemia, and that is because what we say chronic blood loss in the intestines, and this is one of our now first step in early diagnosis of chronic cancer.
And one of the advantages of this technology is that you're not treating blindly. You are actually treating as you see, because as I had explained to some of us who had come to the booth, it's real time. You can see on the ultrasound what you are treating, and as my colleague Dr. Wang is going to show you, you treat as you see. So even before you go home, we can be able to tell how much of this fibroid we have actually managed to treat. Of course, the evolution of treatment has come from times when we used to do just open surgery. So we used to cut your abdomen, cut other tissues, go to the uterus, cut the uterus. Over time, we've changed, or rather we have improved. Initially we had been at a point where we were doing minimally invasive surgery, which is called laparoscopy, and I'm going to show you. But now HIFU brings another different dimension, where you are treating without actually cutting anything. And therefore that means no blood loss. Majority of the times when you go to to the hospital and you need to be operated, sometimes you are told you need to be transfused. How many have heard that word of transfusion? Hands up, that you need some blood. You can see. When you come to HIFU, we don't tell you that you need transfusion. We just treat you, and that is the advantage. So when you come to the doctor, when you come to us, and we say, okay, we determine you have fibroids, we of course will give you all the options of treatment. We will tell you, you can be done what is called open surgery, which is this. So this is a wound. This is called laparoscopy. Basically, it is surgery, but surgery that does not involve a lot of cutting. And this is HIFU. All of them for treatment of fibroids. By show of hands, how many would pick this one? Let me see. By show of hands, how many would pick this one? Okay. By show of hands, how many would pick this one if they have fibroids? Let me see. Show of hands, the ones who love this one. By show of hands, how many would love this one? If you have fibroids and you're told you've not been cut, how many would love this one? By show of hands. So the choice is as clear as day and night. Because you can see the complication rates are low, no cuts, no blood loss, and it is same day treatment and you go home to your usual activities. This basically is to demonstrate the rising access and the rising numbers of patients who have undergone HIFU for treatment of fibroids. And you can see up to 2024, which is last year, the data shows that there is increased access and demand for these services. And that's why as HIFU Center Nairobi, we have brought these services closer to you.
Let's watch this video. In the video, we can see this yellow one probe under the water. We call it treatment probe. Also, it's a transducer. This transducer can convert the ultrasound energy into electrical energy into ultrasound energy, and through this probe, this transducer, it can emit several ultrasound waves and finally focus in one very precise point. We call it biological focal point. And in this focal point has a very high temperature that can reach up to 65 to 100 degrees. So the temperature generated by the focal point can burn the plexiglass plate, and the temperature and the null focal point is very low, so it will not cause any harm to the body. You can see in the video, we can put our hands under the focal point without any damage.
Also are significantly reduced when you exercise. So that in itself is one of the remedies we recommend for women who have painful periods. So it does help significantly.
My name is Pauline, and years ago I was diagnosed with slight adenomyosis, but it was after numerous consultations with gynecologists. You know, like they just, most of the time it's just dismissive, or you're given the usual Ponstan or tranexamic acid to reduce the flow. So by the time I got to the adenomyosis, again, there was not much information on it. So how would HIFU assist in that front? And also at the same time, what are the other treatment options for adenomyosis?
Thank you for that question. So with one of the challenges with heavy menstrual period or even painful periods is that unfortunately for the longest time, ladies, women have been ignored, and I think that's why there's a huge campaign now on educating women on what is normal, what is not normal, and also it's very important as a woman, as a lady, if you feel your primary doctor or your clinician is not maybe listening to you or giving you the kind of information you want, it's always good to get another opinion, because sometimes, unfortunately, we've had that series where you feel you're not being treated or you're not being listened to. And that's why we are so glad that we're living in an era where women can now voice out their issues without the fear of discrimination or being put down. So that's number one. Secondly, as HIFU, we are really committed to health education. not as much as we are focusing on uterine fibroids, adenomyosis, and HIFU as one of the best options available for our Kenyan women, we are committed to provide health education basically across the spectrum of reproductive health, so that even as we touch on fibroids, we're also educating our sisters, our friends, our colleagues on just their reproductive health. And I think that will enlighten the population on the issues that women are facing and how to go about that.
As you are aware, blood has protein in it, and any time it is trying to rot, then there will be the smell. So layer number 2. Layer number 4, unique and exclusive padding for well-balanced absorption. That's what we are talking about, to maximize the absorption that the pad can be able to hold. And this is important. Why? You are in the office. You probably are in a very long meeting. Our pads, we can comfortably tell you that you can be with it for up to 6 hours, comfortably. And that you will be able to pass there, we shall be able to give you even a sample for you to sample and find out whether it is possible. Soft, layer number 6, soft breathable waterproof bottom film, which allows air circulation. Air circulation, when there is air circulation, again, it minimizes the issue of bacteria growth. That is also very important. And then layer number 8, soft and individually pacified wrapper, protects the pad from dust, such that even before you use the pad, it is already by itself as clean as it came from the factory, from the machine. So that is a very important area to look at, and that is just one of the examples that we are talking about. This is the range that we have currently of sanitary pads. We have what we call Dada Care Classic. That is what you will get a sample. It is a 290 mm long. Then we also have Dada Care Regular, again 290 mm long. Then we have an overnight, which is a 340. That would be for those heavy times of overnight, for example. Then we have a daily liner, a 180 mm. This you may want to use on daily basis, whether you even have your periods or not. It is very thin, very comfortable to wear, and you will see the advantage when you have them. You can also get a sample of that there. And now, apart from that, we also have other products in the range. We have 100% cotton tampons. Cotton tampons, that's all the way from superior in terms of size, in terms of how much they can hold. It is 9 to 12 grams. We have a cotton regular, 6 to 9, and then we also have super plus, 12 plus to 15. And also we have a combi pack. This combi pack is for those very heavy days. And apart from that, we also have other products that we have currently introduced. We have the first in the market, a foam wash that is probiotic. This is important to ensure that the pH balance is maintained. It is fragrance free, meaning that you don't have to use a perfume that you don't know or you don't like. So it is fragrance free. It is expertly formulated to align with the natural pH of your intimate areas, ensuring optimum freshness and comfort throughout without any overpowering scent. So it leaves you as natural as possible. Then we also have the first again, Dada Care Intimate Wipes. These are very important again for you, instead of using tissue and the risk of getting infections from, again, and contact dermatitis when you use tissue paper. What is unique about these particular wipes is the fact that they are actually flushable. Not many wipes have been advised that you can actually flush them because they can cause blockage in the toilet. But this one, because of the biodegradability, you can be able to easily flush them and without any fear. So it gives you that environmental and peace of mind to look at. Then We have other new products that we are expecting. For example, we are in the development, and let me remind you that Dada Care, Lady Care is a 100% Kenyan product, and we are doing our own research on products, seeing the problems that are in the market, and we, as much as possible, try to address them. And that is why we are also coming up with other products. For instance, we are coming up very soon with maternity pads. That is another area that we've seen our women suffer so much, getting very substandard maternity pads, and that's what we are working on, and we are hoping that this is a product we should be able to introduce by close of the year. So there are some of the partners that where you can get the products. They are already available in some of the supermarkets like Carrefour. You can get them online from MyDawa. There are a number of pharmacies. Help you, all the outlets have them. And we are still in the process of speaking to the major supermarkets to ensure that the product is available. And that is how you can be able to contact and get to interact with us. Thank you very much for your time, and I'm hoping that we shall be able to see you this afternoon, as we are going to be offering the same products, especially the classic. We are going to be offering it for 200 shillings for a pack of 8. Thank you for your attention and for your time.
My name is Dr. Shaunak Khandwala, and I'm the fertility specialist at Fertility Point, where we have 2 centers in Nairobi and 2 more centers which have come up in Kisumu and Mombasa. So I also am at the clinic at Parklands, and we have our main center at Upper Hill. Talking about infertility or the types of infertility, first I would like to further go into the classification, and that is, one is primary infertility and the other is secondary infertility. So primary infertility is one in which a woman has never ever conceived. She could have had an abortion earlier on or a miscarriage earlier on or an ectopic pregnancy, but she never has conceived a full-term this. So if she has had an abortion or a miscarriage, it is secondary infertility. But if she's never ever conceived, then it is primary infertility. And as you were asking me also the causes of infertility, so besides the age, of course, the causes are many. So there is a female factor. So in a couple, there is a female factor and a male factor. And in certain cases, both are involved. Both the husband and wife could be having a problem. And there are 10% of this infertility couples where there is something called unexplained infertility. That means there is no factor either in the man or in the woman. It could be just that they are not staying together enough, or it could be some other thing which is not bringing the gametes together. Gametes means eggs and the sperms together to fertilize and therefore give a rise to a conception or a pregnancy.
Thank you for that. How common is infertility in our population?
The incident infertility in East Africa is almost like 1 in 5 or 20% of the reproductive age couples. So that's quite a lot. But there are different treatments. We'll come to that later, of course, but there are different ways of managing the infertility. Most of the infertile couple just need a proper counseling and initial investigations. And then when you discover something more, then some of them would go to the stage of doing IVF, where we come in, because Fertility Point specializes in doing IVF and so many other things.
And I think what we are hearing here is we've been emphasizing the wrong issues.
Yes, we are actually emphasizing the wrong issues, the non-issues actually.
Because we all saying we want the government to buy us radiation machines and...
Even if the government buys us a radiation machine, even the government buys us free PET scan, and then you are not supporting these people. When you have up to date, my family, me now have my family's and my siblings' business. I no longer make any decision on my own because they said, no, you are our business. If you're not supporting your people, then how do I get well? You can imagine someone who is gone for treatment, they have lost their eye. I lost all this. This just came out. This is 1 year old. I lost my nose. I never used to have these glasses before chemotherapy. I lost like one day. I was in ICU for 7 days. My system literally knocked down. If my people were not there to support me and say, Nana, you have to fight on, I could have easily died. So the support system in Kenya, I'm sorry, especially among the family, is completely broken. It is sand. Leave alone Nairobi, in the villages, in the slums of this town, the system is broken. That is why death rate is going up each and every day. Each and every day, can you imagine we are losing 7 women to breast cancer in Kenya? Each and every day we are losing 9 women to cervical cancer. Last year alone, according to labzote.com, they said we had new cases of prostate cancer of men between 35 and upwards, 3,582, meaning every day in Kenya, 10 men are being diagnosed with prostate cancer. The most disgusting part of it, and I point that to you because you are all men, is out of 54 or above million population, only 16% of us are going for medical checkup and 2% are men. So these people, they don't even care about themselves. 2%, do you know how many men are those? Very few number. They don't go for PSA. Dr. Lalit is here, you tell you today, you just need to go and poke like malaria. They get your blood sample, 11 minutes, you have your results through the list. But they go and tell each other in those men conferences, in those men shit, they go, utaenda kuguzwa happy. It's a lie. Please, men, can you go for a test if you are 35 years and above? And it is not a laughing matter anymore. Please go for PSA. At RFH, we have extremely good prices. You can come. It is your body. It is the only thing that you have.
Yeah. Thank you, Nana, for picking on us men yet again. Even but I think what we're getting is, one of the questions I was going to ask is, are we looking at lifestyle and all the other issues? But clearly we are not. We seem to be having a total emphasis on the end treatment and not on prevention. And you should know what we discussed at the men's conference. I was chairing very recently. So don't worry, we are having these conversations, but you need to understand, I'll defend men because I have no choice but to be one. And my friend Trump recently made it clear. There are how many genders? Okay, there are no 16 anymore, so now it's a clear 50-50. But part of it is, you also raised it. For a while, you also had that denial. Yes. What would happen? You knew, you suspected. And it's the same reason also why a lot of men are not going for post-test.
Yeah.
It's the same fear. Because don't forget, for most men, they are also the breadwinners. Or they've been made to feel like without them, the world will come to an end. So you can imagine if your fear was that. Imagine how much more fear is there in a man thinking, what if I do have it? Unfortunately, we are one-sided in our fear. We don't use the fear to get us to act. So we most likely go, I think it was called, fright? What are the reactions? Flight, frightened. Yes, but there's one where you become numb. You freeze, isn't it? So it seems for most of us, we freeze. Instead of using that fear to fight. Until it got bad, is when you decided, let me fight. But the question is, what we're hearing is, we're starting to fight too late. So we need to start fighting earlier. And having a support system. I think you raise a very interesting issue. Stress is critical.
Oh, yes.
But no one is talking about how do we control stress. Maybe that's what we need to tell the government. One, biggest stress for most of us in Nairobi is traffic jams.
and money.
So possibly, maybe if we improve the traffic flow in Nairobi, the number of cases of cancer might drop. But just to move on now that we finished with the fun part again is, now as we move forward, this is more to, Nana raised it, hormone therapy, you say it?
Yeah, I'm on hormone therapy.
Hormone therapy?
Yeah, because my cancer is hormone related, it's not generic.
Okay.
Yeah, doctor.
There's hormone and genetics.
Yes.
Okay. And Wesley raised a new one, which is Hope. So these are new AI-driven treatments for cancer. You know, there's Hope, there's hormone. What are the others, Dr. Alex? If we think about where do you see the treatment of cancer in 2030, 2050?
So if you're talking about treatment of cancer, it has tremendously progressed in the last 10 years. Since the time I did my training to now, there has been a sea change. You know, every month there is new data, new published study, new cancer drug, a new surgical treatment, a new radiotherapy treatment, better equipment. So there's a lot of things that are happening throughout the world for cancer treatment. And also, and then many of it is still, it's available here in the country also. We have that. We have the best of the radiotherapy equipment, the diagnostic equipment. We have access to chemotherapy. We have access to immunotherapy drugs, which are the newer modalities of managing cancer patients. We have good, surgeons who can manage a cancer surgically. So down the line, I think the treatment of cancer would be more focused on, reducing the side effects of the cancer. But as an oncologist, my dream is more into prevention. You prevent or you detect the cancer early with the screening test for other cancers. Not having the cancer is better than having cancer. So if we can achieve that, nothing like it. So right now we have screening tests for a handful of cancers. There are so many cancers, there is no adequate screening test. So if we achieve that, that would be really great.
But Dr. Lalit, if we prevent the cancers, where do you make money?
So I would be happy. I would focus more on, I know this question is coming, so I would focus my thing on, preventive oncology, early detection, molecular testing. So everything is at a molecular level now. So there is tremendous scope of doing that kind of work also.
Thank you. Lastly, Wesley, where do you see the technology side? Where do you see the treatment of cancer in the next? For you can even tell us in the next 50 years. You're young enough.
Okay, so thank you. So on top of hope, in terms of management of cancer, allow me to say that there are currently advanced technologies in cancer management. For example, we have what we call 4D treatment. This is whereby we employ a 4D camera to monitor the breathing and the movement of the heart so that the precision of treatment is high. And also we have neutron therapy, we have proton therapy, all these lie under radiotherapy, and they're already practiced in first world countries. For example, proton therapy, it's very precise, and as a radiation therapist, I'm able to deliver high doses in shorter fractions. For example, when we are doing something like SBRT, I'm able to deliver a dose in 5 fractions, unlike when I'm using EBRT, which we have at RFH, where we deliver in 25 fractions. So if we reduce the amount of fractions, basically what we're doing, we're cutting on the cost of treatment. That is where the technology is going on matters cancer management. So RFH, we have a second banker, and I believe the management will bring in this new technology so that we are able to handle these issues here locally.
I'd just like to add that women or couples who would like to conceive should come and visit us, visit a healthcare professional, and we'll give you advice about what my colleague is talking about. Because you find a young couple smoking, drinking, and they expect, to conceive and get a healthy child. And it's very difficult to conceive when a woman is heavily smoking or even getting secondhand smoke from her partner and drinking of alcohol. Of course, we know what the effects that will do to your baby. So as part of nutrition, visit a healthcare provider as soon as possible. Don't wait until
1 year, 2 years, you're expecting to conceive naturally, nothing is happening, and your lifestyle is the same. Your lifestyle should change, come to us, listen to what advice we have to give. So we're giving women advice about even simple weight loss can expose a woman faster to pregnancy. And we advise the different foods that we encourage a woman to take. Those who are going through menopause, those who want to conceive, those who breastfeeding. So at different stages of life, our needs differ. And apart from Google that will scare you and say you've got 2-3 days to live, come to us.